Good time. Why am I in this appearance this time around? Yeah, I just remember my years in the past. This is a story I would like to share with my fans and my followers, and I think you can get best of it if you listen to this program to the end. Yesterday I was in a restaurant. I found a beautiful lady eating chicken, rice, drinking juice with a young man beside her. And I shook my head that this food meant a lot. So what happens after Valentine? Yes, some over 20 years ago, when I needed to operate on a young lady who happened to be pregnant, and the pregnancy was an abnormal one, ectopic pregnancy. This is one of the abnormal pregnancy that will occur. Share this with your friends. What is ectopic pregnancy? It is good for everyone in life to be told I'm pregnant if you are looking for it. But what if the pregnancy is in the wrong place? When the pregnancy is located in the wrong place, we refer to it as ectopic. What are the locations in a woman? So you start like this. This is the womb. This is where pregnancy is supposed to stay. Outside this place, any other place is called ectopic. So what are the areas? Number one, the cervix. See it down here. Pregnancy can settle there sometimes. Such a pregnancy cannot last. 2, look at the ovaries. It can be in the ovary part. Pregnancy implanted itself there. That's also an ectopic. 3, it can be in the fallopian tube. It's also not a normal pregnancy. 4, it can be in the abdominal cavity. That is also ectopic pregnancy. So sit back and let's discuss the commonest one, the one that occurs in the fallopian tube. What is the causes? What are the symptoms and signs? And what's the way out for it? Signs and symptoms of ectopic pregnancy. What are those signs? She may not even know that she's pregnant, but notice one is sharp pain either in the front or the side, depends on where it is. Pregnancy with a sharp pain means a lot. And then the next thing, spotting blood. Do not take such signs as play. Visit an hospital immediately. It may mean more than what you can imagine. 2, feeling weak and tired. Yes, pregnant person can be weak and tired, but this will be in excess that will lead to fainting attack. Suddenly fall down and faint because the pregnancy is not in the right place. 3, such person can begin to have a pain in the shoulder. When you have pain in the shoulder as a pregnant person, it's obvious, confirmed you're also bleeding inside. Bleeding inside, you can be deceived. It's not coming out of the vagina. And so you feel nothing is going on. But you are fainting and you're having pain in your shoulder. You might need to visit hospital before it is late. Don't forget, ectopic pregnancy is a medical emergency. That any delay is death. But any early action is life-saving. So, causes of ectopic pregnancy are: number 1, recurrent infection in a woman that is not properly treated. You have STI, sexually transmitted infection, which could have occurred on Valentine Day. And you don't know you already carry chlamydia, or if you carry gonorrhea, or you carry any of the STI, or syphilis, or any other is with you already. And pregnancy occurred that yesterday. The infection will not allow the pregnancy to travel back into the womb. That's one of the causes. 2, if you have had a surgery on your womb before, is a potential reason to have ectopic pregnancy. 3, if you have had ectopic before, you're at risk of having another one. That is why you cannot play around after first solution. Number 3, as young as you are at risk more than the older ones. Because of what? Because your fallopian tube may not be well developed to ensure a travel back of the pregnancy into the womb. What is the solution way out for ectopic pregnancy? The way out first is for you to identify you are pregnant. 2, you need to visit doctor early, hospital where they can operate. 3, you need to run tests to confirm your status. A scan is necessary to know where the pregnancy is. And 4, you need to know your blood level to know whether you have been losing blood inside. And 5, you might need to be on medication. You'll be admitted in the hospital to be on some medication that can kill the pregnancy inside development if it's at the early stage. If it's at the late stage where you're already bleeding inside, it is not drug, it is surgery. Yesterday is gone. Today is here. You do not know whether you are one of them tomorrow.